I am pleased to welcome you to today's webinar titled 5 Ways to Use Data for Advanced Analysis. My name is Stacia Whelan. I will be the moderator for today's discussion. Before we get to the presentation, I do have a couple of housekeeping items. During the presentation, all participants will be in listen-only mode. Additionally, today's webinar is being recorded and will be made available to you after the webinar. Although the phone lines are muted, we do encourage you to ask questions during today's presentation. So please submit any questions that you have during the webinar within the questions or chat window that's over on the right-hand side of your screen. With that, I hope you enjoyed today's webinar, and I'm happy to introduce our speaker for today, Eileen Cianciolo, Chief Product Officer for SCIO Health Analytics. Eileen brings 25 years of healthcare experience, including leadership roles in product management, product development, and operations to SCIO. As the Chief Product Officer, she leads product innovation, management, and development. Eileen has held senior leadership positions across healthcare, including several large health plans, an industry-leading healthcare analytics company, as well as experience with care and wellness organizations. She holds a master's degree in finance and financial management services and a bachelor's degree in accounting and business management from Walsh College in Michigan. And with that, Eileen, I will turn it over to you.
Thank you so much, Stacia, and good morning or good afternoon to all of you. I appreciate your time and your patience as we work through our technical difficulties. And with that, I'm going to go ahead and move into our agenda and just going to go through what we're going to talk about today. So, we say 5 ways to use data for advanced analysis. We know that there's many more than 5 ways, so today we're going to be touching the surface of what some of those different ways are that we can use data in order to be able to apply advanced analytics across healthcare. And some of those ways are, 1, obviously understanding your population, 2, allocating the resources. We know resources are something that is scarce, and we need to make sure that we're utilizing our resources in the most appropriate way. Avoiding costly procedures and services, and delivering, we've got both 4 and 5 in delivering personalized care. We have a couple examples within that area. Some of the things that we're doing here at SCIO around delivering personalized care and analytics that support that. And then we'll just wrap up with a summary, and then as Stacia said, please ask questions along the way through your chat box where you can add those in. And we'll have a few polling questions as we go through, so I encourage you to participate. And again, thank you for taking time from your very busy days. And the summer is short, and we all have a lot on our plate, so I really appreciate your being here today with us. So just to start out, healthcare IT news, I thought would start with just taking a look. There was about 95 healthcare executives that were polled at the end of 2016 saying, for 2017, where they plan on upgrading and focusing around technologies and their spend. And it was not too surprising to see as far as analytics, the percentage of 51% indicated that analytics is an area in which they planned on spending and investing in. Interesting that when you look at the other areas that were indicated, and obviously they could select more than one, you look at population health and patient engagement, both at 44%, and then also in the remote patient monitoring, 24%, revenue cycle management, 22%, EHR, 31%. And really, I would argue the fact that analytics, while it's 51% of them, it's the area of focus, that analytics apply to and can be used to leverage all of the other areas that were indicated as far as areas that they wanted to be able to focus on and that were important for them to be able to invest into. So, analytics, I am obviously a huge proponent of. I think that without the data and analytics on top of it, it's very hard to be successful in any area of a business, much less in the complexity that we have within the healthcare industry. Another important point, there was a Bloomberg poll recently where 64% of the respondents across the United States reported that healthcare is their #1 concern. Healthcare, #1 concern, 64%. That's above jobs and unemployment and terrorism as well. Yet of those that responded, that 64% is a top priority for them, that they didn't feel that we actually were doing a very good job at delivering healthcare and improving healthcare. So it's a pretty big message, and it's concerning. And I think that there's a lot of complexity that we have within the healthcare industry, and being able to break that down with data and analytics to understand where we're at and where we need to go and how we can leverage the data and turn it into actionable insights is really key and important. We all know value-based care is growing. It's not going away. We know that the tipping point of actually what we expect to see from moving from fee-for-service into value-based reimbursement is going to be around the year 2020. We know that the sustainable growth rate for the SGR for physicians was been repealed in 2015, right, and replaced by MACRA. Right, which has two main payment options within it, the MIPS and the Advanced Alternative Payment Model. And so we know that value-based reimbursement is not going away, and we're actually are moving from that fee-for-service in incremental steps to capitation. And there's a lot of complexity. Not only is there just complexity in understanding all of the rules and all of the acronyms, because when you read about it, and if anyone not in the healthcare industry were to pick it up and try to read it, it's complex and wouldn't make any sense just because of the complexity in it. So trying to focus on where it is that we can leverage data and advanced analytics to be able to drive where it is that we should engage, intervene, focus on our populations. So moving from that fee-for-service to capitation is definitely a journey, and it's not a simple one, where we're looking at paying for coordination and moving on to paying for performance, episodic payments, and being tied to episodes of care, shared savings programs on the capitation. There's a lot of complexity in this, in which data and analytics is key to be able to understand and to drive the most efficient, highest quality care and get reimbursed for it appropriately. So this is a simple slide, but boy, is there a lot that's included within it, right? So all healthcare organizations across whatever market you're in, and we have a broad range of attendees today across all markets, that everybody needs to have and wants to have and strives for that holistic 360-degree view. And I mean, and that's whether it's a member, per patient, I like to call them individuals, or it's payers and understanding everything about a payer or provider. It's only data that is going to tell us and provide us with that holistic 360-degree view. So there's some key things in the data. It's one thing to state big data, and there's a lot of different data sources involved in healthcare. We all know that, and they're not simple, and there's a lot of complexity involved in them. But there's so many different things to consider when you're looking at how to leverage data for analytics within your business and what that's telling you. And not only is each company at a different stage of analytic maturity, but even within that company, the different areas, whether it's your quality, it's your care management area, it's your marketing even, right? It's across the board, every single area, and even focus on, is it, for your Medicare population that you're covering, your Medicaid, your commercial, right? Where are you at as far as the stage of analytic maturity? Because chances are, even within an organization, you're going to be at different stages. You could be at descriptive, where you're just reporting off of, and I don't say just lately, it's very important to be able to report off and to roll up and to understand where you're at. But then there's the next level of actually taking and doing some prescriptive, where you're going, and taking that all the way through very proactively from an analytics perspective. So everyone's at a different stage of analytic maturity, and understanding where you're at is key. And then we've all heard big data, and it's a buzzword. It's very important, ability, because we have so much data that we're dealing with in the healthcare industry, being able to consume that data, to normalize that data, to leverage that data is key. But what I think the next stage that's even more important is the small and specific insights within that big data that can be leveraged and used in order to be able to improve and take steps towards your goal of where you want to go, what you want to achieve, depending on what those goals are. And all of us have very similar goals, but we're at different places along that maturity level. So being able to take the big data and to find those actionable insights within it are key. And then to understanding and layering in the individual journey, the patient to some, a member to others, and an individual to all, right? Of ultimately, along that journey, in all of the complexity of healthcare and the data and the analytics and interventions around it, we're ultimately trying to improve, ideally, that individual's quality of care and their health and quality of life. And we're trying to do it in the most efficient, effective way and get it reimbursed for it accordingly. So we can't forget the individual's journey in this and how it is that our goals fit in and layer on top of that journey, and how we can use data and analytics to be able to take specific interventions that's going to help them improve their overall quality of life and their health. And then align that with the objectives of your goals of your organization. It's key. You've got to understand where you're at, where you want to go, in order to be able to then use the data and the insights to take incremental steps in order to get to that goal. And I'll often say that it's just like the GPS. If you don't know where your current location is, even though you may know where you want to go, you got to understand where you're at. Otherwise, you're not going to be able to get there. You can reroute along the way, and we all will, and we all do, based upon the updated information that we get, timely, accurate information and insights that help us to adjust along the way in order to be able to get where we're trying to go. So the next slide, I'm sure you've all seen multiple different versions of this, because I think it pretty much applies across the board to everyone as we look at the importance of being able to take in the multiple different data sources. And again, this is everything that ranges from the clinical data, the claims data, the socioeconomic data, device data, anything that we can get our hands on that is going to help us to be able to create that 360-degree individual profile of an individual, so that we can calculate and we can analyze everything that we know about them, so that we can see how it is that we can intervene in order to be able to continue to help improve their overall quality of health. Right? And everyone is different, and everyone responds to interventions differently. So all of that has to be taken into consideration when you're doing your analytics and your modeling. And then the visualization of it is key, because it's one thing to have all the data there and you have the risk scores and modeling around it, but how you can roll that up and visualize that so that you're focusing on the most important areas that you can actually have an impact on is key. And yeah, what does that drive? Absolutely, across the board, right? Risk and revenue optimization. So being able to ensure that you're getting reimbursed in the way that you should. Quality improvements. What needs to be done? Where should you focus those precious resources in order to be able to improve your quality measures across the board? Population health management, I would say it's a broad term that's used. It's another buzzword. It's very important, but really it's managing across your entire population, their health. And so where do you need to focus? Those populations can be extremely large, and so we only have so many resources to be able to manage them. So where do we focus? And network optimization is obviously key. And actually, we're going to be having another webinar at the end of this year around our network optimization. So being everything that I'm going to show you today as far as analytics that can be leveraged, we can take those and we can break those down and look at the network effective. So take it and look at your providers and understand their efficiency and quality and steerage opportunities and network leakage. But all of it is dependent upon being able to effectively leverage and intake data and apply your analytics and drill down and visualization on top of it. So with that, I'm going to go through just some different slides and examples on different ways that us here at SCIO, the way that we use and leverage the data for our advanced analytics. So again, key questions to ask yourself, and this is each area of the organization, is to say, do you know where you're at? Okay? Do you currently know in your quality measures in your population where you're at? What does it look like? What's your population look like? How are you doing as far as from a revenue optimization perspective, care optimization? Do you have the data and the analytics capabilities that you need to understand your business? Well, and take a look at it. And if you don't, take a look and take steps as far as what you need to do in order to be able to get there, because those are foundational key elements to be able to leverage analytics. You got to understand and be able to, in an easy way, have summary dashboards to help you understand that population, so that you know what is your data showing you, and where should you focus, and what can you do with that data to go beyond just traditional analysis and analytics. I mean, we know, and we've all had identification, stratification, risk scoring models have been in place for quite a while. Health plans have been managing population health and attempting to manage population health for quite a while now. And so where do you take that next as far as the next level in advancing your risk models and your stratification of your population? How do you take it to the next level? What action should you take? And then, very important, is have your actions that you've taken made a difference? Right? Because none of us have a lot of extra time to take actions that actually aren't resulting in positive outcomes that we're looking for. So constantly measuring your actions and looking at your outcomes and determining what's working and what's not, and constantly feeding that back into your overall process so that you can change the way that you're doing things to optimize. And things are going to constantly change, so you're going to constantly need to be looking at what and finding your outcomes and improving that feedback loop back into how you change what you do. So this is a constant. This isn't a one-time thing, constant thing, and it's a constant evolution. And the maturity of your analytics will continue to evolve if you continue to follow this end-to-end process of feeding your outcomes back in. So with that, we've got a polling question that I'd love to have your input in, as far as based on the maturity progression levels that are listed below in the multiple choice options. What type of analytics does your organization currently use? Is it the descriptive analytics, which is really what and why is this happening? Is it predictive? What if these trends continue? What does that look like? Or prescriptive, what can I do about it, or is it all of the above? So I'd love to get your input on the poll. So we'll give a few seconds for people to respond. Okay, and we're going to close the poll and then look at the results. And I'm not able to see the results.
So the results are showing, Eileen, that there's equally 36% of our attendees here are using descriptive and separately predictive analytics. 0 are using prescriptive. However, some of that might be a mix within. 29% are using all the above. Pretty interesting.
Great, great. Yeah, no, that's very interesting, Stacia. Thank you for that, and thank you everybody for your input there. It's always interesting to see, from the analytics maturity model, where everyone is at kind of across the spectrum. And I'm sure that probably even within the different areas of your organization that you're at a different stage. And I think that's totally normal and to be expected. So let's go on to talking a little bit as far as understanding your overall population. So population risk and stratification, like I said, being able to roll up and being able to understand simplistically where your population is at from just a high level is key. So taking that data, being able to take a look at different, applying risk scores against it, so whether it's a concurrent, right, or a prospective risk score, and being able to understand where your current population is at and breaking it down with simple visuals. That with those visuals, though, you can actually drill down all the way to the member level so that you can first have a high-level picture as far as high risk, medium risk, low risk, right? And these are simple things as far as being able to understand and to stratify your population. Looking at how many members you have within it, looking at the distribution of your age and the age and gender of your population, your unique lives and patient months, average lives. But the key is being able to drill down into the information in each of these levels to where you can continue to get to the next level of detail all the way down to the specific member and understanding of the member, what specifically that you can do with your population to intervene and with those specific members. But first and foremost, this would be in the descriptive of just rolling up your population into a simple view of which you can just see how it is stratified really across the board and what that population looks like. Now, as you get into actually being able to compare your risks, we've got, and all of SCIO's models are models that we've developed ourselves and published papers on, and we have a concurrent risk score, which is showing based upon the last 12 months where your current risk is at for your population. Then we also have a prospective risk score, which is saying, okay, based upon if things continue as they are, what is your risk score going to be looking like 12 months from now? So where is it that this population, both concurrent and prospective, is heading? And then based upon that, okay, where is it that you can actually have an impact and to intervene with that population? So it's key to be able to not only have that data that rolls up, but then be able to drill down into the population, categorize it by the high and the medium and the low, but even within high, medium, and low, right, being able to break that down further as far as understanding where the risk is at with your population, both from a concurrent perspective, where they're currently at, as well as if things were to continue and you weren't to intervene, what you're going to be looking at 12 months from now. So that then you can take that and you can use those comparisons also when, after you do intervene with the population, you can look from an outcomes perspective and compare and to see if that prospective risk score that you had assigned a year ago, when you actually have intervened, were you able to impact it? Were you able to drop it? How did it change? Why did it change? And what can you learn from that change that you can feed back into your process of how you can continue to intervene with that population of that similar, whether it's a chronic condition, certain age group, certain persona, which we'll talk a little bit more about. But obviously being able to stratify your population and looking at both concurrent risk as well as prospective is key. So none of us, I guarantee, on the call have unlimited resources at our disposal to be able to use. It's not realistic, not effective. So with our limited resources, so if we have nurses and doctors, where do we want them to be able to focus? Who in our population should we be focusing on in order to be able to drive the best results that we're looking for in order to achieve our goals? So from a chronic condition perspective, we have disease management and case management. There's wellness programs. Who should be in which program and when, and how should we engage with them is key, because we want to make sure that where we are applying our precious limited resources and expensive is in a way which is going to make the biggest impact for our population, for that individual's health. So how are we going to focus on it? And being able to drill down into that and to understand is key. So from a population perspective, taking that risk and being able to break it down into, we have what we call it is an impactability model. And our impactability model, really it takes and it improves on our prospective risk by stratifying the members based upon the opportunity to actually be able to impact those predicted costs. So what's that probability of actually being able to have a reduction in avoidable inpatient and ER visits if gaps in care were closed? So we take and we build off of that concurrent into the perspective, add in an impactability model to say, here is where you have the best chance to be able to focus on a population. If you close the gaps and focusing on the quality care, the gaps in care, if you close these gaps, this is where you have the biggest impact to be able to avoid avoidable inpatient admissions as well as ER visits. So again, being able to drill down into and to say, where is it that I should focus my interventions on? So that ability to predict and identify, prioritize opportunities for the greatest improvement, right, that was going to drive your clinical as well as your financial outcomes. So impactability breaks it down even further, those that are highly impactable. And so that you can focus your resources appropriately with the right program in order to be able to intervene with that population. So again, gap closure is key. So that impactability model really takes and breaks down, and then the visualization of being able to say, if I close, what is my potential savings? If I closed the top 3 gaps in care that have the biggest opportunity financially to be able to avoid those avoidable utilizations from an inpatient perspective as well as ER. So these are things that we can feed right directly interoperability into like a care management platform or into an EHR that helps to focus on at an individual at a summary level, but then also breaking all the way down to an individual level of what type of an intervention and a program should we try to engage these individuals in order to be able to focus on closing these gaps. What is the financial potential impact that we would have from a cost savings perspective? What does also impact your overall quality, which depending on what type of a reimbursement model you're currently engaged in with your population can drive your revenue as well. But ultimately, helping to close gaps to improve the overall quality of these individuals' lives. So again, impactability, taking that concurrent and prospective risk model further and applying where it is that you can actually focus your resources to be able to close the gaps in care that's going to drive the costs associated with those avoidable inpatient and ER resources. So another polling question then is, what data sets are you currently using for predictive analytics? Are you using clinical or a combination, clinical being EHR, clinical record data, or is it coming from both clinical and claims data, or all 3, including socioeconomic? So we'll give it a few seconds for the polling.
And Eileen, it sounds like you as the presenter don't have the privilege of seeing our polling results, so I'll read them to you again.
Thank you.
So the results are in, and it looks like 8% are using clinical only, 42% are using clinical and claims, and 50% are using clinical claims and socioeconomic.
Great, great. That's fantastic because, as I said, the more data that you have, the more comprehensive of a picture that you can, and a profile that you have on an individual so that you can determine how best you want to respond. Now that's truly, in my opinion, the personalized and the very prescriptive care, which we're going to segue and get into a few of those different things in the next coming slides. So we're going to talk a little bit now about avoiding costly procedures and services and what some of the analytics are that can be leveraged in order to be able to accomplish that. So another one of the models that SCIO has developed is what's called preference-sensitive treatment models. And really what this is it's taking a look at determining high-risk patients. For certain conditions, really I call them ailments, which there's no definitive clinical guideline and there's multiple different treatment options that exist. And so really it's sometimes, people are a little biased towards like surgery, for example, for a knee replacement or a hip replacement, based upon the assumption that they have that it provides the highest quality of care, where actually what is found is that, first of all, we all know these surgeries are extremely expensive, and in a lot of cases, there are less invasive treatment options that actually provide equal or even better outcomes with less complications than going to and having that surgery and that knee replacement or hip replacement. So our model here on preference-sensitive treatment model really identifies and stratifies members with certain what we call preference-sensitive conditions. And we really then break those down into and assign a severity score that really takes in several things into consideration, right? The risk of the avoidable surgery that's within the next 12 months. And then taking a look as far as the episode cost. And then the time as far as how much time do you actually have from now until that point of which the potential for surgery is out there. So your kind of window of opportunity to be able to intervene and actually to provide some education in order to be able to provide that individual with the information they need in order to make the decision that's best for them, which not in all times, but in a lot of times ends up being the most cost-effective as well as the best outcome for that individual. So our preference-sensitive model really helps you to be able to delve in. So for example, here you've got people with a composite risk score, you're being able to see in your population of 48% for a specific condition that you are looking at whether or not you can intervene, and you can break them down and see the cost that's associated with them. And then the breakout as far as the condition actually, and you can see as far as those that actually fall within the low, the medium, and the high, and potential savings, that if you were able to intervene within that time window, and we break, the population is broken down that way too, so that within that time window, here's where you should intervene, reach out, education, to be able to, again, provide that individual with the information they need to make the decisions that are best for them. So, an example, right, of someone with a severity 1 might be at the stage as far as they've received an x-ray of the knee or an MRI of the knee. And a severity 2, they may have moved on to as far as diagnostic, like a diagnostic knee arthroscopy, or then on to level 3, which is the partial or total knee replacement. So if you were able to understand, as that we can do with the preference-sensitive treatment models, and then the visualizations around those, where you can see those that actually break down the visualization into those that have a high potential savings with a small window opportunity, right? So you don't have much of a window to be able to intervene and to make a difference there, versus down in the lower left-hand corner, low potential savings with a small window. So not a lot of savings and not a lot of window to intervene, so not somewhere where you would want to focus your resources. However, where you have up here in the upper right-hand corner quadrant, the high potential savings with a large window of opportunity. So taking these, and then the size of the bubble represents as far as the amount of potential cost savings that's associated with that, and then the color of it indicates the specific condition. So focusing your resources over here on those individuals that fall within the conditions that you can have the highest potential of savings with the largest window opportunity to be able to intervene would be a smart choice as far as being able to focus those resources, those limited resources that we do have. So our preference-sensitive treatment model, a way to be able to, again, all of this is looking at how to be able to stratify and break down your population so that you can understand what is the most appropriate intervention that you should take for your population. And all of these can be drilled down right to the member level and then integrated in with any of the programs that you have so that then you can actually execute upon the intervention and then outcome results to feed that back in and to see how successful you've been and how you can improve upon that to do that continuous feedback loop of improvement. So personalized care. So many of you spoke about the use of both clinical and claims and socioeconomic data. So I'm curious then, we're going to just be a little more specific here on how your organization currently is using socioeconomic data. So are you using it to calculate your risk, to identify the most appropriate interventions, to determine the best methods to engage with an individual, or is it all of the above?
I'll give them a couple seconds here. Okay, Eileen, so it looks like 29% is using socioeconomic data to calculate risk, 29% for identifying most appropriate interventions, 0% for identifying the best methods to engage with an individual, and 43% for all the above.
Wow, great. Yeah, no, that's very interesting, and I'm sure that there's more and more of you that are looking at and thinking of ways to be able to use it in order to be able to engage with an individual, because, and we're going to talk about that in a second, of some of the techniques and uses of being able to take that socioeconomic data to be able to be very prescriptive in what, not only what intervention someone should be engaged in, but how, where is the best chance to actually getting them to be able to comply with the goals, the actions, the steps that you want them to take in order to be able to improve their quality measure, their condition, their overall health. How best are they going to engage? So that's very interesting. So let's talk a little bit more about using socioeconomic data and incorporating in how best to intervene with your population and how best to engage with them. Because even though you may have a program that you think this is what someone should be enrolled in, that doesn't mean that that person's going to participate in it and that you're going to get engagement and you're going to get the outcomes that you want. As every single person is different and engages and responds in different ways. So again, taking the data and the socioeconomic and including it with the other data and being able to try to understand attitudinal data as well to how is it that an individual is going to respond. True kind of behavior management, really. So with intervention optimization, what we like to call it here at SCIO, it's really focusing the resources, in this particular example, on chronic conditions where you have the largest impact with the least complex intervention. So what is that intervention that you should use for which population, and how best can you intervene with that? So when you look at intervention optimization by condition, you can visualize the conditions based upon impactability. So the impactability would be here across as far as being able to look at those who are harder to impact with like incentive, like needed an incentive program, those that would respond better to a less complex intervention, easier to impact. So where you could actually incentivize population in order to be able to, and there's different incentives that people respond to. So we have a whole analytic capability of looking at what type of incentive for what population has and what type of program has the best chance for them actually being able to comply with and to engage in that program to drive the best results. So you can see that within this, there's the size. The cost is, again, like with impactability, the size of the bubble. The color is the condition, and then where, for this individual population, what type of an intervention is going to be the most effective for that population, and then how does that actually break down by that impactability by the different conditions, as well as where the cost is allocated across those conditions. So as you can see, in a maturity level, as far as analytic maturity, you're continuing to get more and more mature in being able to break down, analyze, segment, stratify the population, and in order to be able to determine how to intervene with that population. What is the best type of a program? What would this population be most incented by in order to be able to comply with the program that you're trying to get them to engage with? So again, understanding those details of the distribution by impactability, by condition intervention. So this is just was drilling down into hypertension, right? So within that, again, being able to drill down within that population and understand overall those with hypertension, where they fall from an impactability perspective. Intervention-wise, where is the best way to be able to intervene with what type of an intervention? And then compliance rates of being able to see and compare against benchmarks, which is key across the board. Being able to understand where you are with benchmarks in a population that's similar to yours, so that you can see how you stand up. Because if you're first just looking at the percentages and say, well, is that a good, are we doing good or are we not? I mean, we know that there's quite a few that are high here as far as compliance rates with the reports and some of the measures, but where do we stack up against others? Are we doing good or are we falling behind? And then how can we actually take and customize the interventions that we have for our population in order to be able to improve that overall the population and results? So personas. I mean, I'm sure based upon the poll that many of you have done work around personas, trying to break your population down into the different categories of really profiles of your population based upon socioeconomic factors and your data, so that you can yet again break it down another level to be able to understand your population even more. So being able to take in that zip level, the demographic, the socioeconomic, incorporating in the fitness data, incorporating in your device monitoring data, right? All the demographics that you can get, incorporating and breaking it down and compiling different personas so that you understand based upon that population and that persona, well, again, what does it look like? What do your costs look like? What do your conditions look like? What do your gaps in care look like? Where can you intervene? Where can you have impact? The more data that you have and that you can break down, you can categorize, and you can segment your population, the more information that you have at your fingertips to determine what it is that you need to do next. So that, to me, is the prescriptive analytics of really being able to say, for this population, what do I know about them, and how can I intervene with them? And you can drill it down to the individual level to where then you can take that information, you can feed it into any of your programs that you have, whether it's your care management, your disease management, your wellness. It's going back into the EHR, into the workflow, so that you know where you should focus on for this individual to drive your overall goals, improving quality at the most effective and the most efficient way, and being paid appropriately for those services. So again, there's no one way to look at a population. There are multiple insights that you have and ways that a population needs to be broke down in order to be able to truly analyze it and understand what you need to do with your population, where you need to go, and you got to know where you want to go, and then what can you do to get there. So we break our personas down into taking a look at, we're using all of our different models really that we have from our risk scores and prospective risk scores that we have, to be able to break it down and to understand, well, across these, the healthy and the affluent, the balanced adult, high utilizers, quality driven, cost conscious, and again using socioeconomic factors in order to be able to determine these. And then what do you know about them? What are the number of average chronic conditions? What's the inpatient utilization, the ER utilization? What's the inpatient PMPM and the ER paid PMPM? right? So that you can look and you can say, all right, for my high utilizers, I probably need to do an intervention around ER utilization and understanding the urgent care options that are available in the network. Maybe I do need to look at contracting where I have more urgent care that are within my network. What can I do in those high utilizers to try to educate and bring down some of the costs that are associated with my inpatient in ER? All the way across to the baby boomers, which we know, higher number of chronic conditions, high inpatient utilization in PMPM. So what programs, and again, being able to take these personas and then drill down into them from an intervention perspective to understand where it is that you should intervene is key. So another subset of the population that breaks it down further in order to be able to understand yet another level of how you should manage that population, what you can do with it. And applying those personas obviously is key across the board. So what program? What's the most effective? We all have different programs that we have. We all want to be able to make sure that the individuals are in the appropriate program at the appropriate time with the appropriate intervention in which they are going to respond to the best. And the only way that you're going to be able to do that is by using your data in the most effective way, using advanced analytics in order to be able to drill down within that population, to segment it, to truly stratify it in multiple different ways, multiple different levels, using all of the data that you have in order to be able to drive the engagement into the programs that you need in order to be able to improve that individual's, either keep them healthy or help them get healthy and improve their quality of life. But it's there's just no one way to look at it. There's multiple ways that you need to look at your population and analyze it, and analytics applied on top of it in order to be able to determine where you're at and where you want to go. So with that, I would like to just close with and then we will have opportunity for some questions that you can enter through the chat. But it's analytics, just like healthcare, just like life, is a journey. And it's important to know where you're at on that journey, where you currently are. And as I mentioned, it's not all about big data. It's about finding that, taking that to the next level, and finding those powerful insights within the subsets of the data. And it's key to be able to pivot and to look at the data from the different views in order to be able to get a true understanding of where it is that you're at, in order to be able to take the steps that you need in order to be able to go where you want to go. And you've got to have that vision. Not only know where you currently are, but have that vision where you want to go. And I mean, and that's broke down into each of the individual areas that you have within your organization. What's your vision, where you want to go? How can data help you get there? And take the steps one after another in order to be able to get there, adjust along the way. And advance the data and advanced analytics are critical to it. And taking action and making sure that where it is that you're spending your resources and the actions that you are taking are going to drive the best results for your organization and for the individuals that you serve within your organization. And measuring the success. It's a constant loop of what are you doing well, what's not working, and it's going to be the data that's going to tell you what's working. If you can effectively manage your outcomes and you can measure your outcomes, you can take that information, you can feed it back in overall to your actions and repeat, repeat, repeat. And it's an ongoing journey, but it's it's a fun one, and I hope that all of you view it that way, that analytics and the data and what we can learn from it is exciting. It's a challenge, but without it would be sitting with our GPS without knowing what the next step is. So with that, I'll see again, Stacia, if we have any questions at all before we close.
We do. Yep. And just a quick reminder, if you have a question, please submit either through the questions or the chat window. It should be on the right-hand side of your screen. And we have had a couple questions come in. And so the first one here is around impactability. And so if you can clarify, is impactability at the population or the individual level?
It is both. so you can view impactability at the population level. As with any of the models and analytics that we've gone through today, you can roll it up and you can see what it is at the population level, but you can drill down to, and it's calculated for each individual member as well. So for every single member, individual patient, there's an impactability score that is created that you can leverage to drive any of your enrollment into the appropriate intervention or program.
Okay, thank you. And the next question is around the risk models that you referenced. The question is, what is the basis for your risk models? You talked about concurrent and prospective.
Yeah, so concurrent, again, they are all proprietary models that we've created. Our concurrent risk score takes a look at the last 12 months of claims data that we have, eligibility data, whether it's pharmacy data that we have. So taking a look at that 360 view of the data and takes a look and says, okay, where assigns a score as far as what that current individual, and that's all done at the individual and again rolled up. This is what the current risk score of that individual is based upon the last 12 months of data. Versus the prospective is then taking a look and saying, with the same data, where is it that we would anticipate without interventions, if the trajectory continues as it has the last 12 months, what would that risk score look like for that individual 12 months from now?
Okay.
Okay.
And I think that's all we have for today. Just as a reminder, today's presentation was recorded, and we will make that available in the coming days. Thank you, Eileen, for some great content and material that you covered today. If you have any questions after the webinar, you can always follow up with within our website. We have a contact us form that you can complete, and we'll get right back to you. This concludes today's presentation. Thank you for your participation, and have a wonderful day.